When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Good morning. I'm Dave Kaufman in for Elias on the Elias Macco Show, and it's time to bring in Dr. Abdu Sharkawy. I call him Canada's doctor. He's an infectious disease specialist. You can see him frequently on the CTV National News with Lisa LaFlamme. And Dr. Sharkawy, I know that you were surprised to see this move by the government of Quebec announcing that there will no longer be daily COVID-19 updates. How does this make, from the medical side, from the health professional side, does this make people's jobs harder who work in hospitals?
I guess it may certainly make work a bit harder. I guess the prevailing question here is why? What is the basis for releasing this data less frequently? And my concern as a healthcare professional is the response that the public at large, exercises when they have an awareness of how severe this pandemic is and how that's changing. And I think that has an impact on people's behavior. Early on in the pandemic, when there was a high degree of public awareness, a lot of attention being paid, sometimes from hour to hour, never mind day to day, I think it did change people's behavior. People were more accepting about restrictive measures. There was a general sense of vigilance that you could feel in many parts of places like Montreal and Toronto and other parts of Canada. And my fear is that as that sense of awareness starts to decay, people's attitudes will become more and more carefree about what's happening. And, you posted those pictures of people, outside of bars in Montreal. It's leaving people's sense of conscious awareness when the updates and the data are being provided less frequently. That concerns me. I see no potential upside other than making the situation out of sight, out of mind, by informing the public less frequently. And so that's a long way of saying, yeah, that does make my job more difficult because I expect to see more people in hospital as a result of them just not being aware of what's going on.
It's such a concern. And I try to balance the understanding that people have been confined for months on end right now, and they want to go outside and they want to breathe fresh air and they want to see their friends and their family. And I feel it too. Trust me, I feel it too. It is a strange sensation to continually be broadcasting from my living room. But on the other hand, when you see what other countries have gone through and other regions have gone through, if you see what's going on in the United States right now in so many of the states where they've seen, yesterday in the U.S., there were 35,000 new cases of COVID. It makes me scratch my head, Doc, and I question why the government would be doing this. And then I'm concerned with the fact that when I speak to the press attaché for the premier this morning, they say, oh no, this is purely a health issue and that Dr. Arruda will be addressing this today.
Well, I'd be very interested to hear in what Dr. Arruda has to say to help justify why this decision was made. And, I think that unfortunately what's happened during this pandemic is there's been a lot of false dichotomies that have been drawn here, specifically the economy versus health. And I say that it's a false dichotomy because you can't sustain a healthy economy. You can't build a healthy economy without a healthy consumer base, a healthy community, and a healthy labor force to manage that economy. And, any really good health economist will tell you that that's the truth. If you feel like you can take shortcuts to try and do whatever you need to reignite an economy and get it back on its feet, not being cognizant of the fact that you need to keep everybody healthy, it's a very short-sighted way of doing things, and you will lose in the long game. And so I think that's part of the problem here. I think there's a lot of motivation and a lot of pressure to try and open up and help people feel as though things are getting back to normal and trying to reignite the economy. But I think this is a dangerous way to do it. You pointed to the United States. There's been evidence in Iran, in other countries that were more heavily hit, that when we lessened the restrictions that were initially seen in those countries, we're seeing resurgence of cases. This is not strep throat. This is a pandemic. When people get over this, there are waves that are waiting to return to take over if we don't sustain the same pressure and the same degree of vigilance that improve things, between March and June. And I really fear that we're leading ourselves down a dangerous path towards what will happen with a second wave that will coincide with the flu season. I think if people are worried about what happened in March, wait till you see what will happen in November and December if we continue to feel as though we've washed our hands of this. That keeps me awake at night.
Dr. Sharkawy, I got to end it there, but I'm going to ask you just for a yes or no answer to finish the segment. Are we at the end of our first wave yet?
No, not even
Dr.
close.
Dr. Sharkawy, thank you. Follow him on Twitter at SharkawyMD. That's Dr. Abdu Sharkawy.